I talked to the chief of cardiology, Bernie Clark, at St. Francis Hospital about an article I'd read, and he says their CT, 128 slice CT angiogram, the higher the slices, the better it is in terms of diagnostic capability. They started off at 16, then they went to 32, then they've gone to 64. It's really considered pretty leading edge if you have a 64 slice CT. St. Francis has a 128 slice CT, and I think a 256 model is on the way. In terms of development, whether it's actually being sold commercially, at this point I can't say. But the resolution that you get, the only problem with the CT angiograms is there's a fairly hefty dose of radiation. And there is enough radiation to generate cancer in somebody. But the new protocol is currently this. The old protocol is this. You come to the chest pain, you come to the emergency room, say, I'm having chest pain. I'm short of breath. I had pain that went down my arm, went into my jaw. It lasted for about 10 or 15 minutes. I was just working around the house. I wasn't excited about anything. In other words, you find all the reasons to exclude the anxiety. You find all the reasons to exclude the acid reflux. You find all the reasons to exclude the arthritis and bursitis of the ribs. And these are the conditions, not the only conditions, but these are the conditions that we generally call in the differential. And the differential is differential diagnosis. What condition could this be? And of course, the greatest concern is that it's a heart attack. And also the concern is that you might miss diagnosing a heart attack. So what we do now is the patient who has a chest pain that sort of clearly is not indigestion, that clearly is not arthritis and bursitis of the ribs, that clearly sounds like it could be angina or a heart attack. We draw a series of blood tests, and then we admit them, and then we do a nuclear stress test the next morning. Well, the study came out that showed that I think it was 64 slice CT angiogram was much more diagnostic and found much more disease than did the nuclear stress test, which is the current gold standard. Now, one of the things that we have as a problem in medicine is, what do you do when you find disease processes in people who may or may not be complaining of that symptom? There are some people who have very severe disease on MRI on their back of disc disease, have no symptoms. There are some people who have very severe disease in their coronary arteries, no symptoms. And it has been decided more or less that angiograms, angioplasty, and bypass surgery should be done for the symptomatic. We do know this. People who have very severe three-vessel disease, all three coronary arteries, and people who have what's called the left main, and I recently got into a debate with somebody, kind of shocked me. Left main is see, there are three coronary arteries in the heart, but two of them come off one trunk, and that trunk is called the left main. So there's the left main that gives rise to the left anterior descending and the left circumflex. Then there's the right coronary artery. So right, circumflex, and anterior descending are the three coronary arteries. And those have branches, marginals and diagonals and posterior ventricular branches. But mainly we're interested in those three coronary arteries, the right, the circumflex, and the anterior descending. Those two come off a common trunk. Well, a narrowing of that common trunk has an extremely bad outlook, like severe narrowing of all three coronaries has an extremely bad outlook. And it has been shown that you're better off being treated with surgery than you are treated with medication for those conditions. The only problem is that if you look at an angiogram and it shows a 99% narrowing in a major blood vessel, and you're sitting there thinking it's only one blood vessel, should I do an angioplasty? Should we do open heart surgery? Should we leave it alone? It becomes a little hard, and that 99% narrowing is scary. So maybe that person has learned to get blood flow through the other blood vessels. I don't mean they learned it like they learned how to read. I mean their body has adapted in that fashion. By the way, don't you think I should replace Don Imus and Larry King? My goodness, I am the absolute perfect replacement for them. I'm aware, I'm youthful, I have a great deal of knowledge. I can cook. I can have cooking demonstrations. I could get together with that Rachel 30-minute, whatever her name is, and I could sit there and critique the hell out of what she does. But on the other hand, maybe I could get her to make in a tasty fashion some vegetables and beans and vegetable soups all in 30 minutes. And I can do that, but my cooking skills aren't like highly organized. And so I can do it, but it takes me a little longer than 30 minutes. That's why I did the cooking video, so that you could see how to do it in 28 minutes, I think it is. Don't forget the contest. Remember, what's best about this program and what would you like to see changed? What's worst about the program? So this 128 slice CT angiogram, which does deliver a fair amount of radiation, is very good and even better than the nuclear stress test at detecting advanced coronary artery disease. And diabetics tend to have what's called a neuropathy. And that means there's something not quite right about their nerves. So they may be having what we call ischemia, which is actual inadequate blood flow of the heart muscle. They may be having ischemia and have no sensation of it because of their neuropathy. And this test, the 128 slice CT angiogram, could pick that up with the hefty dose of radiation. I think it goes something like this. For a 32 slice CT angiogram, the amount of radiation units was like 12 or 16, which I imagine it's the same or more in the 128 slice. It was like 5 or 6 of those units. It's small m, capital S, small v, and I don't know what those, some person's name that has an S in it. And so it was like 12 or 16 for the 64 slice angiogram. It was like 5 or 6 for a coronary angiogram where they inject the X-ray dye directly into the coronary artery. But you see, you have the risk of putting the catheter up to the heart, which can cause irregular heartbeat, which can tear a coronary artery. And there is a morbidity, which means problem, and mortality event that go with the that goes with the coronary angiogram that is much reduced with the CT angiogram. 10 chest X-rays are one of those units. Not one chest X-ray, 10 chest X-rays is one, coronary angiogram is about 6, and 64 slice CT angiogram is about 12 to 16. So is the 128 slice more or less? Will the 256 slice be more or less? I can't really answer that for you. But it was much more revealing, was my point, about than the nuclear stress tests, which also are somewhat revealing and somewhat better than the standard stress test. So right now I've been discussing with the chief of cardiology at St. Francis Hospital, Bernie Clark. Actually, he's head of medicine, but he was head of cardiology. So he's a cardiologist and a very bright guy. He's, if you think I have a youthful appearance, he has an even more youthful appearance. He's like a little kid, but he is like one darn smart little kid. So that's kind of the message.